Question 61. Making sure that the client participates in normal activities of daily living such as getting dressed, brushing hair, and eating is A. The responsibility of the client's family. B. Done when the nurse aide has time. C. A violation of the client's rights. D. A necessary part of the care plan. Answer D. Explanation. Every client should be encouraged to be as independent and active as possible. Participating in their own ADL is important. Even clients who must remain in bed can often still participate in their care. They can move and turn in bed during the linen change. They can assist with their bed bath and perform their own oral care. The nurse aide should encourage the client to do as much as possible. Question 62. When giving a back rub, the nurse aide should A. Apply lotion to the back directly from the bottle. B. Keep the resident covered as much as possible. C. Leave extra lotion on the skin when completing the procedure. D. Assist the resident to lie on their stomach. Answer B. Explanation. Back rubs can promote relaxation by giving you a chance to observe the resident's skin. Although you will warm the lotion in your hands, the resident may feel chilled during the back rub. Cover the resident with a bath blanket for warmth and privacy. Expose the area being massaged, then return the blanket when finished. Question 63. You're making an occupied bed. To remove the bottom linens, you should A. Remove them when the resident gets out of bed. B. Roll the linens up from the bottom of the bed. C. Raise the resident off the bed with a mechanical lift. D. Tuck the bottom linens under the resident. Answer D. Explanation. Always start by telling the resident what you're going to do. Raise the bed to a comfortable height. After removing to the top blanket and sheet, cover the resident for warmth and privacy. Roll them to the side with the opposite side rail up. Roll the dirty bottom linens tightly toward the patient, tucking them under the resident's shoulders, back and feet. If the mattress is soiled, clean and dry. Place the clean linens on the bed, rolling to meet the dirty linens. Tell the resident they will be going over a bump and help them roll to the clean side with the side rail up. Move to the other side of the bed to remove the dirty linens, cleaned and dried any soiled areas, and pull the clean linens into place, making sure they are smooth. Tuck in all corners and place the clean top sheet and blanket. Question 64. Why should you wash a resident's hands before a meal, even when you're feeding her? A. To reinforce table manners. B. To prevent spread of illness. C. To remove self-esteem. D. To remind them of childhood. Answer B. Explanation. Washing hands before eating is important for everyone. A resident's hands can be soiled from touching objects, as well as their noses and mouths between meals. Even if the resident is being fed, they may touch the food or their mouths during a meal, increasing the risk of spreading germs. Be sure to wash under fingernails, which carry the most germs. Question 65. What is important to know about making an occupied bed? A. To complete one side and then the other. B. To finish the bottom then top of bed. C. The privacy curtain is not necessary. D. The patient is usually uncomfortable. Answer A. Explanation. Always start by telling the resident what you are going to do. Raise the bed to a comfortable height. After removing the top blanket and sheet, cover the resident for warmth and privacy. Roll them to the side with the opposite side rail up. Roll the dirty bottom linens tightly towards the patient, tucking them under the resident's shoulders, back and feet. If the mattress is soiled, clean and dry. Place the clean linens on the bed, rolling to the meet dirty linens. Tell the resident they will be going over a bump and help them roll the clean side with the sign to roll up. Move to the other side of the bed to remove the dirty linens, clean and dry any soiled areas, and pull the clean linens into place, making sure they are smooth, tuck in all corners, and place the clean top sheet and blanket. Question 66. Aids to position to a patient include all of the following except A. Pillows, B. Whole yard lift, C. Bath blankets and towels, D. Footboards. Answer B. Explanation. To help position a patient, a variety of items and devices can be used to prop the patient on their sides or to keep knees and ankles from rubbing together. Use blankets and pillows. A washcloth can be rolled to place in the hand of a stroke patient to maintain a natural position. Roll a blanket to make a taut canter roll to support the paralyzed side of a patient's body. A footboard is used to prevent foot drop. The patient's foot is placed against it to maintain flexion, as if the patient was standing. Question 67. Proper oral hygiene. A. Prevents mouth odor, decay, and infection. B. Allows buildup of tartar and plaque. C. Isn't appropriate for unconscious residents. D. Is only necessary once a day. Answer A. Explanation. Oral hygiene is important for several reasons. The primary purpose is to keep teeth, gums, and mouth healthy, free from decay or infection. Research shows that it can also help prevent heart disease, memory loss, and autoimmune disease. Question 68. Which is an appropriate task for a CNA? A. Buying Tylenol for the patient at the drugstore. B. Administering medications when the nurse is busy. C. Attending patient care plan conferences. D. Drawing blood samples from the assigned patient. Answer C. Explanation. It is important to every healthcare professional to only perform tasks that are within the scope of practice. As a CNA, you are a valuable team member to contribute to a care plan conference. The other tasks are for the nurse. Question 69. When providing foot care to a diabetic resident, it is important for the nurse aide to A. Keep the water cool to prevent burns. B. Remove calluses and corns. C. Check the feet for skin breakdown. D. Apply lotion including between the toes. Answer C. Explanation. Check the feet of diabetics daily and report any signs of skin breakdown and injury. Because diabetics often have neuropathy or nerve damage, they are unable to detect if their feet is injured. Even trimming toenails can cause an injury. Feet must be clean and dry, especially between the toes. Diabetics need expert care from a podiatrist or a qualified foot care professional. Question 70. When cleaning a male's genital area during perineal care, the nurse aide should A. Clean the penis with a circular motion starting from the base and moving toward the tip. B. Finish by washing the upper thighs and inguinal area. C. Clean the rectal area first before washing the genital area. D. Replace the foreskin when pushed back to wash an uncircumcised penis. Answer D. Explanation. Male perineal care begins by washing the inner thighs and inguinal area. The penis is washed first, starting at the tip. If the man is uncircumcised, retract the foreskin to clean the tip of the penis. Return the foreskin after washing. If it is not returned, it can tighten around the shaft, causing pain. Wash the shaft of the penis, then the scrotum. Roll the mantis side to wash the outer buttocks, then the inner buttocks and rectal area. Thank you for watching.